Hello and welcome for a webinar on muscles of mastication. Just look at this welcome jab. Everybody has got a wide open mouth and they are using those muscles of mastication and such a hot and warm welcome. Muscles of mastication. The word mastication is both for eating and talking, singing as also, because you have to open your mouth wide open while talking loudly. So muscles which bring about these movements while speaking and eating means chewing, for the purpose of chewing, eating, singing, speaking. Okay, so for all that purpose we have a group of muscles which are called as muscles of mastication. And this is a common question in the exams. So many times it is asked, even for Viva you are asked, at least you should know the primary muscles of mastication. Well, let us proceed with this topic, and we have to finish this topic today itself. Look at this gentleman. He's a famous Bollywood actor, and you must be knowing his name, Jim Carrey. He is chewing, and that is what is called as mastication. Okay, even I am doing with my mouth, I'm speaking, and so I am also using my masticators. This guy is using masticators for the purpose of eating something. So what he's doing is mastication. Well, to propel the skeleton, man has 639 muscles. I told you during the time of myology study. And these are composed of 6 billion muscle fiber. Each muscle fiber has got 1000 fibrils, which means there are 6000 billion fibrils at work at one time or the another. And food is the main source of energy for a human being, and this energy derived through the complicated process of digestion. First step of digestion is called as mastication, because without chewing you cannot swallow. So first is chewing, means mastication, then swallowing, then comes your digestion in the first, second, third parts whatsoever in the GIT. So teeth, jaws, and muscles of jaws, tongue, and the salivary glands help in mastication. Saliva is rhythmic opposition and separation of jaws with the involvement of teeth, cheeks, lips, tongue for chewing of food in order to prepare it for swallowing and digestion. So that is mastication. The main purpose of mastication is to reduce the size of food particles to a size that is convenient for swallowing, what is called as bolus formation. So this is also required for physiology. So this is done with the help of saliva, because saliva is a first digestive juice. Okay, there are various digestive juices. You have studied that in physiology. This is introduction about the muscles of mastication in short. Well, the muscles of mastication are the group of muscles that help in the movement of mandible during chewing and speech. So I am using that right now. So without opening your mouth, you can't speak, can't sing. So we need to study these muscles as they control the opening and closing of the mouth and their role in the equilibrium created within the mouth. They also play a role in the configuration of face. So I told you yesterday regarding anatomy of face as far as the facial expressions are concerned. So these aid in that also. Configuration of the face. Okay. There are 4 pairs of muscles of mastication in the mandible, which make chewing movement possible. 4 pairs of muscles in the mandible. So they are all attached to the mandible because maxilla doesn't move. Maxilla is a fixed bone. Okay. The mandible, the lower jaw moves at the level of temporomandibular joint, what we call as TMJ, temporomandibular joint. So these muscles along with other accessory muscles together are termed as muscles of mastication. That means there are 4 pairs of primary muscles of mastication, and there are other muscles which also help in muscles of mastication are called as accessory muscles of mastication. Okay. Here we go for more information about important facts about mastication. So there are about 15 chews in a series from the time of food entry until swallowing. So when the food enters, at least 15 times you chew. So then swallowing begins. Average jaw opening during chewing is between 16 to 20, and average lateral displacement on chewing is between 3 and 5. So this is in millimeter, okay? Duration of masticating cycle varies from 0.6 to 0.1 seconds. So this is all in details about the mechanism of mastication, which actually is not of much importance to you because we are supposed to study only the gross anatomy of muscles of mastication. Mostly the dentists require this information more because their scope is within the mouth. Okay. Well, what are the features of masticatory muscles? We can call these muscles as masticators, and these are muscles of mastication, so they are called as masticatory muscles. They have shorter concentration times than most of the other body muscles. They incorporate more of muscle spindles to monitor their activity. Do not have Golgi tendon organs to monitor tension. Do not get fatigued easily. Now see this. Do not get fatigued easily. That means you eat as much as you want. You speak as much as you want. And they will not get fatigued very easily. Okay. I think the women have stronger masticators because they never get fatigued while talking. I think so. That's my experience. Psychological stress increases the activity of jaw closing muscles. Occlusal interference causes hypertonic synchronous muscle activity. Closing movement also determined by the height of the teeth. Now from this, at least you take this sentence. Do not get fatigued easily. So the masticators do not get fatigued easily. Okay. Now we'll go for the classification of muscles of mastication. Means what are the different types of muscles of mastication? So we classify them in two groups. One is primary muscles. So what we call primary muscles of mastication. And there are four of them: masseter, temporalis, lateral pterygoid, and medial pterygoid. So they are in pair, four on this side and four on that side. So everything is in pair in our body, almost with few exceptions. Now what are the accessory muscles? So accessory muscles are below the mandible. Mostly they are below the mandible and they help little bit for mastication. So digastric, stylohyoid, mylohyoid, and geniohyoid. So they are attached to the hyoid. So most of them are having this word hyoid. And plus one more muscle important. Yesterday I told you that buccinator, which is present on the cheek. So that is also called as accessory muscle of mastication. So four primary. So these four primary should be on the tip of your tongue. Even if you forget the accessory muscle. But as far as the topic is concerned, I will have to take all of them together because those are the part of study of muscles of mastication. So functionally, these mastication muscles are classified into two categories. First, those are jaw elevators and jaw depressors. See, that means this is elevation, this is depression. So depression is downward movement, upward movement is elevator. So masseter, temporalis, medial pterygoid, and upper head of lateral pterygoid, they help in elevation of jaw. So they are called as jaw elevators. So jaw elevators means lower jaw elevators. Upper jaw do not move. Now jaw depressors means downward movement. So these muscles are lower head of lateral pterygoid. So upper head is for elevation, lower head is for depression. Then anterior digastric belly. So belly, digastric has two bellies. So anterior belly of digastric. Then geniohyoid and mylohyoid. Okay. So these are the muscles which help in depression of jaw. Well, now we'll go to primary muscles of mastication. This is take away home. Don't forget this. See these four muscles. Two muscles are seen from front. So while studying the anatomy, first we have already seen these two. This is a fan-shaped muscle which is present on the temporal region. It's called as temporalis. The tendon is coming for insertion on the mandible. And you can see here masseter muscle. Masseter muscle is see on the ramus of mandible and angle. So it's attached to the mandible and then to the zygomatic bone. So this is masseter. So these two are seen from the front, and these two are inside. So we have to see them in the interior. Okay, we can see this lateral pterygoid because it is on the lateral side, and you can see this medial pterygoid. So these are the two pterygoid muscles, and see all of them are attached to the mandible. So they move mandible. So they are called as primary muscles of mastication. So what is masseter muscle? We have in short the gross anatomy of all four of these muscles. In Greek, this word masseter means a chewer. So the meaning of masseter means chewer, one which chews. Okay, chews ला मराठीत चावणेच म्हटलं पाहिजे ना. chew चावणे. थोडक्यात ते खाणे असेल. It is one of the most powerful muscles involved in the power stroke closure of the mandible. Power stroke closure of the mandible. So this is quadrilateral muscle. So quadrilateral means it has got four sides. So it's quadrilateral muscle, partly tendinous, partly fleshy, which covers the lateral part of ramus of mandible. So lateral part of ramus of mandible. It consists of three layers which blend anteriorly. That means they get fused with each other anteriorly. So multiple arrangement of fibers seen as superficial, middle, and deep. So you can see this masseter muscle in this figure. Well, what else we need to know is about its origin and insertion. So origin, because there are T types of fiber, they origin from different places: superficial layer, middle layer, and deep layer. So maxillary process of zygomatic bone. So medial aspect of anterior two-third of zygomatic arch and lower border of third of zygomatic arch and deep surface of zygomatic arch. So if you see in this, everything comes from zygomatic. So in short, this muscle arises from zygomatic bone and zygomatic arch and gets inserted on angle of mandible, okay, or and lateral surface of mandibular ramus, okay. So middle part of the ramus of mandible and upper part of the mandibular ramus and coronite process. That means this insertion is on the mandible. Different parts are shown like mandibular ramus and mandibular coronite process. So we have studied mandible, so you know these parts where this masseter is inserted. Nerve supply is supplied by the masseteric nerve. So it is a branch of anterior division of mandibular. Because mandibular nerve supplies the mandibular area. Mandibular nerve is a branch of trigeminal nerve. So it gives masseteric nerve. And blood supply is derived from masseteric artery, which is a branch of maxillary artery. Because there is no mandibular artery. Maxillary artery supplies both maxilla and mandible. Venous drainage is through mesenteric veins. So all mesenteric branches you can say. Function is elevation of mandible. So it elevates the mandible to close the mouth and to occlude teeth for mastication. Its activity in resting position is minimal. It has a small effect in side-to-side movement, okay, side-to-side movement, and protraction, retraction. Protraction means पुढे मागे mandible करणे म्हणजे protraction and retraction. Now we'll go to temporalis muscle. Temporalis muscle is extensive fan-shaped muscle that covers the temporal region. It is powerful masticatory muscle that can easily be seen and felt during closure of mandible. If you close the mandible tightly like this, you can feel it here. Okay. Bulk and length of the fibers are larger than that of medial pterygoid and masseter. It is the largest masticatory muscle, but not considered to be the most powerful muscle. Okay. Well, now its origin is from the inferior temporal line, floor of the temporal fossa, and from the overlying temporal fascia. Okay, and it is divided into three areas, parts. You can say anterior temporal, middle temporal, posterior temporal. That is in details. And insertion is on the coronite process and ramus of mandible, anterior border of ramus. To be precise, you can say anterior border of ramus of mandible. Now supplies, of course, deep temporal branches from anterior of mandibular nerve. So mandibular nerve once again, branch of trigeminal nerve. Blood supply by superficial temporal artery, branch of maxillary artery, and venous drainage through superficial vein and middle temporal vein. Function is and for elevation of mandible, anterior fiber elevates the mandible. Posterior fibers retract the mandible, and crushing of food between the molars is done by this temporalis. Posterior fiber draw the mandible backwards after it has been protruded. It is also a contribute for side to side grinding movement like this. Grinding. Okay. Lateral pterygoid. Third muscle. It is also called as external pterygoid. So because it is towards external side. That is why it is also called as lateral pterygoid. It is the muscle of mastication that occupy primarily a horizontal position. Okay. It is thick, short, conical, and triangular muscle with two heads, superior head and inferior head. You can see in this picture. This one is superior head and this one is inferior head. Superior head is small. So this is the lateral pterygoid muscle. Origin is from wing of the sphenoid bone. Okay. And lateral surface of the lateral pterygoid plate gives inferior head. Superior head comes from the infratemporal surface and infratemporal crest of the greater wing of sphenoid bone. So sphenoid bone is the origin here. Insertion fibers run backward and laterally and converge into the pterygoid fovea on the anterior surface of neck of mandible. So every muscle is getting inserted on the mandible. Into anterior margin of articular disc and capsule of temporomandibular joint, TMJ. Okay, so it's very close to temporomandibular joint. And nerve supply is again mandibular nerve via lateral pterygoid nerve from anterior trunk. Blood supply is by maxillary artery and ascending palatal artery. Function is acting together. These muscles protrude the mandible and depress the chin. Protrude. You have to bring your mandible front like this. Acting alone and alternately, they produce side-to-side movements of mandible like this. And medial pterygoid now. So the last primary muscle of mastication is also called as internal pterygoid because lateral pterygoid is called as external pterygoid. It is almost a mirror-like image of the masseter muscle. See, though it is a pterygoid, it is like a masseter muscle. Mirror image, but inside it is rhomboidal. So masseter is quadrilateral. So rhomboidal is almost quadrilateral and runs practically in the same direction of the inner surface of the mandible. It consists of two heads which differ in origin, superficial and deep. So this is in detail now. Superficial head comes from the maxillary tuberosity. So it is originally from maxilla. Deep head from the medial surface of lateral pterygoid plate and part of palatine bone. So again, palatine bone gives origin to this muscle. Insertion on the medial surface of angle of mandible. So on mandible. Okay. Now supplies branch of the main trunk of mandible. So all four of them are supplied by mandibular nerve, which is a branch of trigeminal. Blood supply by pterygoid branch of second part of maxillary artery. Function. It helps to elevate the mandible and closes the jaw. Bun. Like this. Acting together, they help to protrude the mandible like this. Protrude. Acting alone, it protrudes the side of the jaw like this. Acting alternately, they produce grinding motion like this. And now we'll go to accessory muscles of mastication. So actually, muscles of mastication are completed, but we as a student of anatomy also should know the accessory muscles of mastication. And there's a big list here. You can see the hyoid bone. So those muscles which are present above the hyoid are called as suprahyoid muscles or suprahyoids. And below the hyoid, muscles are called as infrahyoid. There are four of them: mylohyoid, geminoid, styloid, digastric. These are the suprahyoid muscles. Sternothyroid, omohyoid, thyroid, and sternohyoid are the muscles of the infrahyoid group. But the suprahyoid muscles are, considered as the accessory muscles of mastication. So first is digastric. Digastric has got two belly, and these two bellies are, because of these two bellies, it is called as digastric. They are joined by an intermediate tendon. Origin anterior belly is from digastric fossa of mandible. So lateral to the mental symphysis. So the origin is on the mandible here. Posterior belly from the mastoid notch of the temporal bone. So typically, if you see, all the primary masticators are taking insertion on the mandible, and these accessory masticators are taking origin from the mandible. So insertion both meet at the intermediate tendon and are held by the fibrous pulley to the hyoid bone. So they are not attached to the hyoid bone. The fibrous pulley is attached to the hyoid bone. So digastric muscle and it now supplies nerve to mylohyoid and the posterior delivered by the facial nerve. And function is depression of jaw mainly here. Okay, main function for the mastication is depression of jaw. Both sides contract simultaneously with other movements. Okay. Now we'll go to mylohyoid. Mylohyoid muscle is a flat triangular muscle lying deeper to the anterior belly of digastric. It forms the floor of the mouth and it is flat triangular. You can see in this picture here. Origin is from mylohyoid line of mandible. See the origin. It is on the mandible. And insertion is on the median raphe. Posterior fibers they go to hyoid bone. So it is called as hyoid, mylohyoid. Okay. Now this muscle is supplied by mylohyoid nerve. It's called as nerve to mylohyoid. Helps in depression of mandible and elevation of hyoid bone. And it elevates the floor of the mouth during deglutition. Deglutition means swallowing. Next muscle is geniohyoid. So genio means the angle. Short and narrow muscle lies above mylohyoid. Its origin is inferior mental spine. So mental spine is genial tubercle. That means the bend of this mandible. So bend means genial. Fibers run backward downwards to be inserted into the anterior surface of the body of hyoid. So in case of suprahyoid muscle, you can say that they origin on the mandible and they get inserted on the hyoid bone in short. This is also sufficient as far as gross anatomy is concerned. But the details, if you remember, is well and good. It is called a genioid muscle and it is supplied by hypoglossal nerve. Okay, so first cranial nerve, first cranial nerve, the fibers pass through hypoglossal nerve, not first cranial. It is first cervical nerve. First cranial चुकीचं आहे. First cranial कोण असते? Olfactory. It is only sensory. Typing mistake आहे. First cervical nerve. The fibers pass through the hypoglossal nerve because hypoglossal 12 cranial nerve. त्याच्यानंतर मग C1 देणार ना. That is one. Function carry hyoid bone and the tongue upward during deglutition. So they carry hyoid bone and tongue upward during deglutition. So last part of chewing and the first part of swallowing. त्यावेळेस काम आहे जास्त. Now at the last muscle is tylohyatt. Tylohyatt means tyloid process of temporal bone and hyoid bone. So it comes like this. You can see it's coming very long distance from hyoid bone, styloid process to hyoid bone. Small muscle that lies along the upper border of the posterior belly of digastric muscle. Origin from the styloid process of temporal bone and insertion on the body of the hyoid bone and at its junction with the greater cornu. And now supplies branch of facial nerve and functioning pulls the hyoid bone upwards and backwards. So these are the 4 muscles of mastication as far as accessory muscles are concerned. Infrahyoid muscles, we don't take them in the mastication. Okay. Suprahyoid muscles are accessory muscles of mastication. But apart from suprahyoid muscles, we have one more muscle which is a muscle of face. Facial muscle muscle buccinator. We have already studied that. It origin on the maxilla and insertion on the mandible. You can see this buccinator. Sorry, origin from the maxilla and mandible and insertion on the orbicularis muscle. Orbicularis muscle is a muscle around the mouth. And action of buccinator is for pressing cheeks against the teeth and lips, as in whistling. Draws corner of the mouth laterally like this. Assist in chewing by keeping the food between teeth. Okay. So it helps in chewing. So we call it as accessory muscle of mastication. And it is an accessory muscle of mastication occupying the gap between the mandible and maxilla, forming important part of the cheek. It is also known as muscle of cheek. So it is a part of face. Cheek is a part of face. So it is a facial muscle, but it is helping in mastication. Origin from maxilla, opposite molar teeth from pterygomandibular raphe and mandible opposite molar. And insertion in upper fibrous they straight to the upper lip because insertion is on the orbicularis oris decussate before passing to the lips and straight to the lower lip. So there is no bony insertion. This is insertion on the lip muscle, sorry, on the mouth muscle and lips. Okay, here you can see the buccinator. Now supplies buccal branch of facial nerve that we have studied during facial muscles. Now what it does, it flattens cheek against gums and teeth, prevent accumulation of food in the vestibule of mouth, and to bring the food onto the occlusal table during mastication. So whatever food is between the vestibule it is brought to the table of mastication. साठवणे चावणे साठवणे चावणे. Usually monkeys use this buccinator very powerfully. माकडांना तुम्ही एकदा बघा, सगळं त्या वेस्टिबल मध्ये साठवतात आणि मग हळूहळू काढून काढून त्या टेबलावर आणून चावून चावून खातात. हावरे असतात माकडं, हो की नाही? So sometimes we also do that. Now mandibular movements and role of muscles played that we will see now. So we have completed the muscles of mastication, 4 primary muscles of mastication: masseter, temporalis, lateral pterygoid, and medial pterygoid, and 5 muscles of 5 accessory muscles of mastication: digastric, then geniohyoid, then mylohyoid, and stylohyoid, and buccinator. Now we'll go for movements. Elevation means, okay, prime movers are masseter, medial pterygoid, temporalis, antagonist is superior lateral pterygoid. I have told you this movement during the study of myology. Depression in prime movers are inferior lateral pterygoid and digastric, and antagonist is elevator root muscles. So elevation and depression, these are around one axis, and protrusion and retrusion is another axis. Okay, so prime movers in protrusion are inferior lateral pterygoid, masseter, medial pterygoid. Antagonists are digastric and posterior temporal. Posterior temporal, posterior part of the temporalis. Now retrusion muscles are prime movers, posterior and middle temporal muscles, digastric muscle, and antagonists are inferior lateral pterygoid. And now lateral movement like this: prime movers the working side of temporal muscle, antagonist non-working side of pterygoid muscles. So lateral will also help in grinding like this. So protrusion, retraction. So retrusion is also called retraction, elevation and depression. सगळ्यांना करता आलं पाहिजे. वर खाली पुढे मागे. This you have to do. Then you have to do like this, grinding. So that means ravant karne, just like animals. Okay. Well, I think we have almost covered everything, but masticatory muscles disorders we have to understand as far as the applied endo is concerned. So one is trismus, next is bruxism, next is tetanus, then congenital hyperplasia or hypoplasia, hypermobility or hypomobility of the muscle, then muscle pains, then MPDS, then myositis ossificans, etc., and temporal tendonitis. So these are the different disorders related to the muscles of mastication. Mostly are related with the spasm. Spasm म्हणजे एक प्रकारचा गोळा आहे. So most of them are because they are muscles, and we have to remember the names, not total diseases. And what finally we have to conclude with the masticatory muscles include a vital part of the orofacial structure and important both functionally and structurally. Okay, and we have to see that it can be influenced by a variety of factors, many of which are controlled by practicing prosthodontists. So usually this mastication muscles is in-depth study required for the dentist, orthodontist, or prosthodontist, the dentistry branches, and we have to know only the gross anatomy of muscles of mastication. And I have told you the gross anatomy of muscles of mastication. That is, you have to know the names of primary masticators and accessory masticators. You have to know in detail about the primary masticator, origin, insertion, nerve supply, and action. And you have to understand the movements of the jaw. Okay, elevation, depression, protrusion, retraction, and grinding movement. And this all is shown by this hair. You can see a hair here in front of you, and this guy is dizzy in mastication. सुरू आहे त्याचं. Okay. And with this, thanks a lot for patiently listening to this topic though in short, it is of very much importance for examination. तुमच्या परीक्षेमध्ये प्रश्न हा पडला मसलचा मॅस्टिकेशन तर सोडू नका. इट कॅन स्कोर आउट मार्क्स. आता मी जे बोललो त्याच्यातले 50% जर लिहिला तरी तुम्हाला आउट ऑफ मार्क्स मिळते. And I think that we should end today's webinar with this end slide here. Thank you. Thanks a lot. And see you again tomorrow with a new topic. And now we have to go to the parotid region. So we'll go to the parotid region tomorrow. And we'll start the study of salivary glands for tomorrow. Thank you. Thanks a lot. See you tomorrow morning at 10 o'clock. Have a nice day.